New tonight, it's a mental health nonprofit built on compassion. But workers say compassion doesn't pay the bills. Dozens of employees at the community counseling centers of Chicago claim they've gone months at a time without pay. Those workers tell CBS News Chicago investigator Megan DeMar they fear the group's financial struggles are now hurting the very people they serve.
Caitlin Godat.
I was a staff therapist on the Youth and Family Services team.
Imani Jacquet.
I was also a staff clinician.
And Gabriela Cortina.
And I was a clinical supervisor, Youth and Family Services.
Have two things in common. They all say working at the mental health nonprofit Community Counseling Centers of Chicago, or C4, was a dream job in theory, and they all recently quit.
Because all we want to do is help, and it feels like that fact is being taken advantage of by these people in these positions of power.
We've been covering financial problems at the community-based nonprofit since 2019. Our reporting spurred the Illinois Attorney General to open an investigation back in 2020. C4 seemed to correct course, but then issues resurfaced again this summer. And in August, after a slew of late paychecks, CEO Carrie Brown told us we will work and overcome these temporary challenges, and told workers on a staff Zoom call then,
"We're not in a place of shutdown."
But according to the dozens of employees who have reached out since, it hasn't been temporary. Things have only gotten worse since our last story, much worse.
I needed to rely on family for rent, for groceries.
I was hit with a 5-day notice from my current landlord.
This clinician.
Now we're at a point where savings are non-existent.
And this clinician.
I'm late on several bills and I just got to ignore them.
Asked to stay anonymous because they were still employed at the time of our interview. And they stopped getting paid altogether for nearly 2 months. Right now, they're at least 4 paychecks behind.
It's a very dire, desperate situation.
And they're most upset because they say it's not just impacting them.
Do you think that patient care has suffered as a result?
For sure.
Absolutely, without question.
Yeah, I think
this employee who specifically works with children says she's been stretched so thin that some kids are left waiting for hours or going home from school without care.
It's scary because I think that people stop wanting the help or looking for that mental health support.
And the impact could be life-changing.
And then they quit on therapy. And then there's, oh, here's another person that left me.
Over the summer, Brown blamed a perfect storm of tight cash flows, infrastructure issues and repairs, and reversals of some funding.
The math is in fact not mathing. It is not coming together in a way that makes sense.
My hope is that we get paid and hold people accountable.
But who is accountable?
We've written to them, but they have not responded or provided information.
The BBB Wise Giving Alliance performs crucial accountability assessments on nonprofits across the country.
But I think this does speak.
And their president and CEO, Bennett Weiner, tells me C4 didn't even respond to their request. Most charities do, so that was the first red flag for him.
The key is whether the organization is taking action in order to address those concerns. And as far as who's responsible in doing that, I would say the buck stops with the board.
That brings up another problem. C4 no longer has a list of current board members on their website. C4's most recent 990 available, the tax form for charities, is for 2022, about 2 years behind. And when you try to find C4's annual report, you get this error message.
Having an accessible annual report or information equivalent on a charity's website is essential.
And the irony is lost on absolutely no one that the charity's career page is titled More Than a Paycheck. In fact, during the course of our reporting on this story, C4's website went completely offline altogether. Weiner says all of these red flags will likely make it more difficult for C4 to secure additional donors and grant money.
If you're not making essential information available to the donating public and others, you're going to end up hurting yourself in the short and long run.
When CEO Brown failed to respond to multiple requests for an interview, we paid a visit in person.
I mean, the lights are off.
But C4's administrative building was a ghost town.
We've been inundated with calls from your employees pleading for help, asking us to follow up on this situation.
Brown eventually responded via email telling us, "We are working diligently to resolve these matters responsibly and to stabilize operations," but sharing no specifics as to their plan. Brown blamed CBS Chicago for presenting, quote, an incomplete and misleading picture that damaged the organization's reputation, despite repeatedly declining to be interviewed for this story, the very opportunity that would have allowed us to present a more complete perspective. The Illinois Attorney General's office told me C4 is not in compliance with reporting requirements contained in the Charitable Trust Act. And according to records we obtained from the Illinois Department of Labor, they've received at least 52 complaints with a total of more than $250,000 claimed. Brown said he could not comment on those matters because they are still pending.
And it feels a lot like the agency as a whole is continuing to move, but the body parts are decaying.
It's impossible to live and it's impossible to show up to work and provide the services that we need.
C4 touts partnerships with 8 major organizations, including Northwestern Medicine, on their website. We're still waiting to hear back from several of those organizations, but Northwestern Medicine notably told us we do not have an active relationship with C4. Megan DeMar, CBS News Chicago, Investigators.